It's been described as a crisis, that we're in a mental health crisis. And I mean, are you seeing it personally? Are there things that you're seeing in your own practice that you're saying, wow, I haven't seen this before?
Absolutely. One of the biggest things is you're seeing people who either never had mental health issues, but just having struggles with coping. You know, people are trying to do what they consider safe by guidelines, but they're also not recognizing they're not doing self care.
Mm-hmm.
And therefore, you're having mental health being actually really a struggle, not just their physical health. So, anxiety, depression, grief, all of these have tripled in my practice. While we were always asking, I feel people are used to the how are you?
Mm-hmm.
But now we're going, but how are you really?
I was going to ask about that, about the struggling and the asking. What do you look for with your own patients that might be an indicator that someone is struggling, they're having a hard time?
We talk about how they're functioning. I tell people grief is a part of our emotions, are a part of our society. We are supposed to feel. What we're looking for is when grief or emotionality disturbs our desire of how we live.
Mm.
That's when it becomes an issue. So a lot of times with our patients, what we'll do is have a conversation. It really starts with that. How are you connecting to people? What options are you using? For the younger people, they have the online versions of things now, so it's kind of nice. But what if they're not that person who has internet at home?
Mm-hmm.
Then that's a huge gap that needs to be filled. Um, Increased irritation, anger, outbursts. I've had to say to patients, hey, I know you may not feel it, but how have other people said you're behaving? How other people kind of give way in their input? And then you'll hear a whole host of stories.
Oh, it's so interesting. And some advice for parents or caregivers. I mean, are they the same warning signs you would recommend for them to watch? What should they be looking out for? I mean, they may see their kids every single day, and they would be more sensitive, I would think, to even subtle changes in behavior or some of these other warning signs that you mentioned.
I think we don't wait until we're looking for warning signs. I think we need to just start the conversation. Check in. I think during the pandemic, one thing we've had to learn to say is, have I checked in with my own body? Have I checked in with my own self? How are my family members? So don't wait for something to come up, but you really want to go, hey, how is it going? Find out a little bit more about, have their interests changed? Have their desires changed? Have you noticed a difference in their sleep pattern? It's about us really seeing people versus seeing people. And you're
Mm-hmm.
going to pick up a lot of things through that process of communicating and connecting.